The next disease is HIV, which can progress into AIDS. So the causative agent of this disease is a virus known as the human immunodeficiency virus or the HIV virus. This disease is a progression, so when you initially get infected with this virus, you have a condition known as HIV, and then as the disease progresses, if you don't seek antiviral medication, it can progress into AIDS, which is acquired immunodeficiency syndrome. So as far as how the virus is transmitted, it is transmitted through direct sexual contact, direct contact with blood, so for example, intravenous drug use, vertically from mother to child, whether that be through the birthing process or through breast milk. And with the HIV virus, one of the unique factors about this virus is that it destroys the same cells that are used by our body to defeat it. So the primary cell that the HIV virus targets is going to be CD4 helper T cells. CD4 helper T cells are a very important cell within our immune system. They essentially activate the rest of the immune system. So CD4 T helper cells will typically activate B cells to differentiate into plasma cells to produce antibodies to fight off infections. They also activate macrophages to engage in phagocytosis and activate cytotoxic T cells, which are used to kill virus and cancer cells. So you can see where if a virus was able to destroy CD4 helper T cells, it would essentially be able to wipe out your entire immune response just by targeting that one cell type. And that's what the HIV virus does. When people are incredibly ill with AIDS, it's not the virus directly that's having that impact. It's the virus that destroys the immune system. And then once their immune system is depleted, then they get sick with other viral infections, bacterial infections, fungal infections, cancers, and that's ultimately where all the signs and symptoms come, and potentially even death. So really it has to do with the impact that the virus has on these CD4 helper T cells. So signs and symptoms which correlate to HIV and AIDS are directly related to two things. One, how much virus is in the blood, and two, how many helper T cells are in the blood. So basically, the more virus you have in the blood, the lower your helper T cell count is going to be because the virus targets helper T cells. And again, the lower the helper T cell count is, the more immunocompromised you're going to be, and the more susceptible you're going to be towards infectious pathogens and cancers that would cause the signs and symptoms. Now, let's say someone does get infected with the HIV virus, but they seek antiviral medication right away. Well, when you're on antiviral medication, that is going to keep the virus levels down very low, typically to an undetectable level. And in that case, your helper T cells, you would have a high number of them because the virus would not be present in high quantities to be destroying the helper T cells. So with the viral counts down quite low and the helper T cell counts up high, the immune system would be active and strong, and those patients would not be susceptible to kind of the variety of infectious pathogens and cancers that AIDS patients without treatment would be susceptible to. So HIV and AIDS is not the death sentence that we once thought it as in the 80s and 90s. Nowadays, with modern day medicine and the use of antiviral drugs, individuals who test positive for HIV can live a normal life and remain asymptomatic, and even have the ability to not transmit it to other individuals, assuming they do take antiviral medication every day. Now, if they would go off that antiviral medication, unfortunately, because the virus does establish dormancy in some cells, specifically gastrointestinal cells, if they do go off the medication, the virus will will come back out and begin to become active again in the blood and start to target those helper T cells. So they do have to maintain medication, but as long as they do that consistently for their lifetime, they will remain asymptomatic and not transmit the disease to others. So this image just kind of shows us what we were talking about with the level of the virus in the blood. It directly relates to the level of T cells in the blood. So if someone does not have HIV, they're going to have a ton of healthy helper T cells in their blood. Their immune system is going to be very strong. If they get infected with the HIV virus is going to start to target these helper T cells and destroy them over time until eventually they have high quantities of the virus in their blood and a very low number of helper T cells. At this point, they would be severely immunocompromised and would be susceptible to different infectious pathogens and cancers. It's important to note, obviously, if they seek antiviral treatment, that can stop this progression. The antiviral treatment will keep the virus levels down incredibly low, so the helper T cells count can stay high and their immune systems can stay strong. It kind of depends on the individual how long this progression takes place. Some people may be infected with the virus and after only a few months start to become severely immunocompromised and symptomatic, whereas other individuals may become infected with the virus and it could be 10 to 15 years before their helper T cell count gets depleted to the point where they become symptomatic. So that kind of progression varies on the individual, but again, the whole goal is for the individuals to seek antiviral treatment right away to prevent it from ever progressing to the point where they're significantly immunocompromised. So when someone is infected with the HIV virus, if they do not seek antiviral treatment, eventually the virus will deplete their helper T cells to the point where they will be immunocompromised. And once they become immunocompromised, then they are susceptible to this list of what we call AIDS-defining illnesses. This is in no means something that you need to memorize, but these are basically just a list of infectious diseases and cancers that are common in someone that has AIDS. And again, once they progress to having AIDS, that means their helper T cell count is incredibly low. They are very immunocompromised, and that's what makes them susceptible to all these various illnesses. But an illness that someone gets because they're immunocompromised due to the HIV virus is known as an AIDS-defining illness. It is important to remember that HIV is not the same thing as having AIDS. Like I mentioned earlier, it is a progression. So when you first get infected with the virus, you have a condition known as HIV. And then over time, assuming you're not seeking antiviral medication, the virus will destroy your helper T cells. And then once your helper T cell count gets to a critical level, you will progress to having AIDS. And at this point, you would be severely immunocompromised and would be susceptible to a variety of different AIDS-defining illnesses. So it is important to think about how do we move someone from having HIV to having AIDS? Like what criteria do they have to meet to kind of make that progression? So one of the criteria that they would have to make is obviously they would have to be infected with the HIV virus. But assuming they're infected with the HIV virus, their helper T cell count would need to drop below 200 cells per microliter of blood. A normal healthy person may have anywhere from like 500 to about 1100 helper T cells per microliter of blood. But someone that's infected with the HIV virus and not seeking treatment, their helper T cells are being destroyed. So if their count drops below 200, then they're considered an AIDS patient. Second, if their helper T cell count is less than 14% of all their lymphocytes, so like all their T cells and B cells, then they would progress to having AIDS. A normal healthy individual, about 65% of your lymphocytes should be helper T cells. But again, if someone has HIV, those cells are being targeted, so we expect that that percentage would be substantially lower. And then also, if someone who's infected with the virus starts to experience AIDS-defining illnesses like those rare cancers and infectious diseases, then they would progress to having AIDS. And honestly, usually if they meet one of these criteria, they meet all. So for example, I mean, if you're getting AIDS-defining illnesses, that's likely because your helper T cell count is so low. So you would typically meet all the criteria. But the AIDS progression is the worst part of the progression. This is when patients would be significantly immunocompromised and have a variety of AIDS-defining illnesses. So as far as treatment, it is a treatable disease, but it is not a curable disease. So as far as treatment, patients will take antiviral medications. It used to be quite a few pills that they would have to take every day, but nowadays it's typically one or two pills that have a variety of antiviral medications built into the tablets. The most common one being antiretroviral therapy, or ART. This is just a cocktail of different antiviral drugs that can obviously stop viral growth. It is important to note that it is not curable. The antiviral medication can be used to keep the viral counts down low to the point where patients are asymptomatic and not able to transmit the disease. But it is important to note, because the virus establishes dormancy in the body, if they would go off the medication, the virus will come back out and start to attack those helper T cells again, making the patients immunocompromised again and making them sick and obviously able to transmit the disease at that point. So as of right now, it is treatable with antiviral medication, but not curable. As far as prevention, because this can be transmitted sexually, barrier protection is ideal. Also avoiding things like intravenous drug use, as this virus can be spread through direct contact with blood. And nowadays we do have pre-exposure prophylaxis, or PrEP, which is basically antiviral medications that can be used regularly by individuals who are at risk of coming in contact with the virus. So this certainly isn't for everybody, but if you are an individual who potentially could become exposed to the HIV virus, there are antiviral medications that you can take, like Truvada. You would just take this medication every day as a preventative, and that way, if the HIV virus would ever get into your system, the medication would deactivate the virus before it was able to start an infection.